Hello, my name is Sean Sims. I'm a licensed pharmacy technician and I work for Galt Pharmacy. I'm here to explain some of our blister packaging systems that we have here at Galt Pharmacy. The one I'm going to talk about today is called Dispill. It's a compliance dosing system which helps the clients or residents or even a patient, if they're living on their own, being better able to take their medication appropriately. So with this particular system, we have the client's name or the patient's name here at their top, their information, the pharmacy name. If they were to be in a facility, we can even put the floor and the room number on there as well. Here we have the medication name, strength, the directions. In these little boxes here, we have 4 dosing time options: morning, noon, evening, and bedtime. There'll be a number associated to the time that dose is taken, and that number is how many pills are going to be taken at that time. So on the first one here, it has a 1 in the morning. That would mean there would be 1 of that pill in that particular bubble. It goes through here all of the medications. We have also the expiration date, the RX number, the NDC number of the medication, which is a national drug code number. That number specific all the way down to the manufacturer and the strength. We have the description of the medication, so like yellow oblong tablet, and then it has what the imprint would be on that pill to help identify that pill as well. As we move down here, we see the bubble packs. They're color coordinated according to the time of the day dosing. So the morning ones in this one are yellow. Noon doesn't have a color, and you'll see in this one here on the noon it says not used. That's because this patient doesn't have a noontime dose. Evening is an orange, and then bedtime is blue. Within here, it'll have the day that they take it. So this particular one would have been Saturday, November 16th. It has all the medications that are in here. A nice thing about this particular system here is one, for storage, it'll hang on like a file cabinet folder hanger, so it helps organize your medications easily. Another feature that it offers is if you have a resident that is going to go on vacation, instead of, if they're only going for 2 or 3 days, instead of giving them a whole week's worth and having a possibility of not getting the rest back, you could actually tear off however many days you want to give them. So let's say 3 days, you would tear off the bottom 3 or the 3 for those dates and have them take those with them. It could be asked, well, how would they know that that's their med, not someone else's? Again, each blister or bubble has the patient's name on there, so you can specifically see that belongs to that particular patient. Once we move to this side of the blister where you can see the actual medications, we can put the client's photograph right here. That helps nursing staff during a dispense to make sure they're giving the right medication to the right client. We have the images of the pills over here, which helps identify the medications. And then in the blisters, you can see the particular meds. You'll notice that this particular one is a 7-day week card. So what we would do during a dispensing for most clients that want a month supply, they'd end up getting a 28-day cycle. Up here, it'll have the week. Like this would be week 1. The second one would be week 2, week 3, and week 4. They would start with the week's 1 medication according to the date of dispensing. So this here again is a very unique system. It helps save space. If you're on the 1 blister per medication, you could end up having, let's say, 14 packages really easily for 1 client versus 4. Again, I'd like to thank you for watching this video, and if you have any further questions, please feel free to email Galt Pharmacy. Thank you and have a wonderful day.